ಬಿಜಿಎಸ್ ಗ್ಲೆನೆಗಲ್ಸ್ ಗ್ಲೋಬಲ್ ಆಸ್ಪತ್ರೆಯ ಸರ್ಜಿಕಲ್ ಆಂಕೋಲಾಜಿಸ್ಟ್ ಸ್ತನ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ಮೋನಿಕಾ ಪನ್ಸಾರಿ ಅವರು ಸ್ತನ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಜಾಗೃತಿ ಮೂಡಿಸಲು ಹಾಗೂ ಮಹಿಳೆಯರು ಯಾವ ರೀತಿ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ತಿಳಿದುಕೊಳ್ಳಬೇಕೆಂದು ಉದಯ ಸುದ್ದಿಯೊಂದಿಗೆ ವಿಶೇಷ ಸಂದರ್ಶನದಲ್ಲಿ ತಿಳಿಸಿದರು.
So why do we screen, right? What are the advantages of screening? Screening obviously puts a lady at a little uncomfortable position, that why should I go to get mammogram done once in a year when there is some amount of radiation exposure also with that. There are a lot of advantages which we achieve by doing screening. So what are those advantages? As I have mentioned earlier as well, that if we detect the cancer when it is very small in size, that is it is in very early stage, the cure rates for the treatment are extremely high. A patient will be completely cured of cancer. So that is the first most important advantage, that we are reducing the mortality, that is we are reducing the death rate due to cancer by treating the cancer well and increasing the cure rates after the treatment. So that is one most important advantage of screening, that we have achieved high cure rate because we detected the cancer at a very early stage. What is the second most important advantage as far as we are dealing with breast cancer? Usually if the cancer is detected in a little advanced stage, a patient has to undergo mastectomy, that is removal of the breast, which obviously can be saved if we detect the cancer when it is very small in size. So we call it as breast conservation surgery. So if a cancer is detected when it is small in size, that is in early stages, we can obviously offer breast conservation surgery, wherein we are preserving breast, we are not removing the breast. That obviously translates into better functional outcome, alleviates anxiety and trauma which a female has to go through once breast is removed. So that is second very important advantage, that we have preserved the breast. What is the third most important advantage? That it reduces the intensity of cancer treatment. We have various tests available if we detect the cancer at a very early stage when it is very small in size. There is a small probability that patient may not need chemotherapy, so they may not have to undergo the morbidity or side effects of chemotherapy. So that obviously reduces the duration of treatment and reduces the intensity of cancer treatment. So these are very important, three important advantages what we achieve with screening. Improved cure rate, reduced mortality, we have saved breast, we have done conservation surgery instead of removing breast. Fourth, we have reduced the intensity of treatment. So these are very important advantages which we achieve by doing regular screening.
So when I came to BGS Gleneagles, so I was diagnosed with breast cancer stage 2, and I was asked to go through some basic tests from Dr. Monika and Dr. Matangi over here. And it took a week time for Dr. Monika to diagnose the proper stage and what stage the disease was, and to decide on the treatment. So after a week I got to know my line of treatment, and till then I was very tensed, and basically because of the disease. So everyone, the moment they get to know, it's not so easy to accept and go with the flow. So but here at BGS Gleneagles, doctors made me to get to know this disease and take it and accept it properly and go with the treatment. So when we accept from our side, it's easy to fight the battle, I can say, because once you accept, nobody can stop you, even the disease itself. So Dr. Monika made it very easy for me. So she was very friendly, and she used to sit with us and explain what would be the treatment and how it goes, what's the line of treatment and everything. So I was told to go with the preliminary some surgeries just to remove my ovaries, which was the cause for it, basically the hormones. And I was inserted with the chemo cold, to help to take the chemos and all. And after that, I was suggested to go with 6 cycles of chemos, and after that, a major surgery to remove the lump. Again, like after that, it took a month time to complete the radiations and other stuff. So now I'm going through some 12 cycles of hormone treatment. This is called herceptive treatment. So after some 17 cycles, I'm going to complete my complete treatment on this. So suggestions from my side. So just accept and leave it to the doctors. So they know better, and they know like how to treat. So if we cooperate from our side, like mentally, physically, like if we are fit, and if we cooperate with the doctors, so nothing to be scared, and we can win this battle.